Are you suffering from any kind of symptoms related to cancer, like any lumps or bumps in your neck, any weight loss which is undocumented or you undiagnosed, or you have any abdominal pains or shortness of breath which is not linked to any regular disease but can be linked to cancer? So with these symptoms, we would like to highlight the importance of early screening and diagnosis of cancer, so we can pick up these disease early on and get the treatment started right away so that we can cure the patient.
How do you approach decision-making when determining the most suitable medical oncology treatment for a cancer patient?
So while we approach patients as per international guidelines, when patients come into our clinic, we assess them thoroughly with physical examination and blood tests and other tests that including CT scans, X-rays, ultrasounds and mammograms. Once we have the initial history and physical examination, then we decide about the type of tumor and then the extent of tumor, the stage of tumor. Based on those decisions, we then, as per international guidelines, at US guidelines and UK and NICE guidelines, we decide on the treatment plan. Once the treatment plan is established, we discuss this plan in an MDT where there are surgeons, radiologists, pathologists, as well as oncologists available, where we come up with a treatment plan and then we execute that plan based on the international guidelines.
Could you highlight key principles that guide your medical oncology interventions, considering factors like cancer type, stage, and patient health?
As per guidelines, all tumors are staged for the extent of the disease, if there's localized or spread, and what is the subtype of the tumor. Let's say if it's one subtype and it's done with a molecular pathology, and once we establish that, then we establish the best treatment available. Based on these things, we decide on the best treatment available, and we can then administer that treatment, which can be an IV treatment, an oral tablet treatment, anti-cancer drugs, or can include radiation therapy as well as surgery. So then we decide on the pathway that is done based on these factors, which include the disease, extent of the disease, the tumor type, the subtype of the tumor, and as well as any other comorbids that the patient has. Maybe the patient has hypertension, blood pressure, or has an old age disease which is not able to tolerate extensive treatment. Then we can go with less extensive treatment which is more suitable to that patient, and all of these are based on international guidelines.
In your experience, how have recent advancements in medical oncology impacted patient outcomes?
In the past few years, in the past decade, medical oncology or the treatment of cancer has changed very rapidly. There are new treatments that have come in the past 10 years, which have changed outcomes for patients dramatically. Patients previously patients were very difficult to treat, treatments were very difficult to take, they were very expensive. Now in the past few years, treatments have become more affordable. There are new treatments which have come in which can improve the patient's outcome dramatically, which patients who used to live for a few months now can live for many years on treatment. And those treatments are now more and more readily available in Pakistan in more affordable rates as well, and patients and doctors are more used to using those treatments. And those are the same treatments that are now becoming more common abroad. So now these treatments have come into Pakistan as well, and we are using these treatments readily available in our patients today, and they are, alhamdulillah, improving with the help of those treatments.
Discuss the role of personalized or targeted therapies in medical oncology and their impact on cancer treatment.
So recently, new treatment drugs which have emerged are now called targeted treatments, including immunotherapy, BiTEs, and other targeted treatments which are tailored as per patient's tumor type. So individual patients' samples are taken, their tumor is then seen, and seeing any targeted availables on that treatment. So then we take that treatment and we change it to that targeted treatment which is personalized to that person. So let's say a patient has breast cancer and she has that particular type of tumor. So that particular type of tumor is more effectively killed by one type of treatment that is then given to her individually. So just like that, in blood cancers there are now targeted drugs which can target patients individually. So those drugs don't work on everyone else, they can then work more effectively on that person. So those treatments are available now, and the other benefit of those treatments are they are much more effective. They are more effective in controlling the disease, they have less side effects, and they can take the patient into remission and disease control much more easily, and have a longer patient has a more longer effective and cure rate of that disease with the help of these targeted drugs.
How do you ensure a patient-centric approach, considering individual patients, patient needs, and preferences in medical oncology?
So apart from the targeted drugs which we can use in medical oncology patients, where patients have one target and we can attack that target with that specialized treatment that we can get that. Apart from that, we also see what the patient individual circumstances are. If the patient is old, if the patient has certain beliefs that they don't want certain treatments, we can change that treatment accordingly. If the patient is not able to tolerate that because of some comorbids like heart disease, diabetes, or other age, then we can change the treatment as per patient's guidelines and patient's wishes, that if the one treatment is going to be more effective, then we can change that treatment. So based on that, we tailor the treatment as per the patient's needs and patient's tumor type.
What challenges are common in medical oncology, and how do you address them to optimize patient outcomes?
So we are facing a few challenges nowadays. Because patients in Pakistan, they come in late, the biggest challenge that we face over here is that late presentation of the patients. Patients don't tend to present in early in time, they present when it becomes a bit more spread, the disease advances to a higher stage of disease. So we would, one challenge is to ensure that patients do come in timely, get regular checkups, go to their regular doctors or their healthcare professionals that are local to their area, and ask about symptoms of their cancer. If they have any lumps or bumps in their body, if they have any symptoms of cancer like weight loss, any blood coming from the urine or their stool, any blood coming from their sputum, or they have any lumps which are not going away. So then they should go to their nearest physician, get early checkup done, try to get referral to a specialized center like an oncological center and get early diagnosis and treatment. So early diagnosis can help save those lives. The other challenges that are problem that we have is that readily availability of all the treatment available. So some of the drugs which have come in international market do not readily come in, but they do take time and they are expensive. So the third challenge that we face is financial problems in Pakistan, that patients are not, all of them are not able to afford all of the latest treatments. So then we have to tailor those treatments as per patient's needs and affordability as well. So we have to keeping in those mind, we have to focus on that. Thirdly, patients do have loss of follow-up because of lack of understanding, lack of education about the treatments. They don't understand the full responsibility of taking that treatment, and then once they are not able to fully understand, they don't comply with that treatment as well. So once they don't comply, the outcomes are not as good. So those are a lot of challenges that we face in our daily OPD and our daily clinic activities, but we try to focus on those challenges and try to overcome those challenges and get a patient-centric approach, try to solve them and get better outcomes for our patients.
How do you foresee the future of medical oncology, particularly with emerging technologies and potential breakthroughs?
So as per newer technologies and newer treatments are coming day by day in medical oncology, there new treatments are coming in. Now with the use of artificial intelligence, AI, we have now able to help patients even more. And with the help of newer techniques in diagnosing and subtyping of tumors, we are able to get more targeted treatments available for our patients. So in the future, I do see that there will be more patients who are going to come in early, because we're going to be able to diagnose them earlier, because new techniques are able to diagnose them early stage. We will be able to achieve higher cure rates because of better treatments available, better surgeries available, and we'll be able to get them closer follow-ups. And with the help of AI, we'll be able to gather more information about patients and help more patients of the same disease more effectively.
At what stage do you think cancer is reversible or completely curable?
Early stage disease, which is we define as stage 1, 2 and 3, is where we decide that it's curable. Stage 1 disease is when the patient has very high chances of cure, which is very small tumor size when detected early in the stage, within a few weeks or month. Stage 2 and stage 3 is disease when it's become a little bit more advanced, just locally, not spread to other parts of the body, and it spreads after diagnosis in a month or 2 months later on. When patients present a few months after diagnosis, then they can have stage 2 or stage 3 disease. And stage 4 disease is when we say this disease has spread to other parts of the body, and that is when it becomes very difficult to cure or difficult to treat.
What foods or habits can prevent a patient suffering from cancer?
We have to focus on our daily activities, which include, so the foods that we try to focus on is healthy eating. Try to eat fresh vegetables. Try to avoid vegetables which have been growing in a lot of chemicals. Try to eat healthy food which is freshly cooked at home. Try to avoid over-processed food, which has been preserved for a long time, and because those preservatives can have chemicals and they can have a lot of damage. Apart from that, we insist that patients or people should avoid smoking and any other injurious things that they can use, like shisha smoking or vaping or other recreational drugs. We try to avoid them, because these drugs can have a very bad impact on your body, not just cancer, it can also cause heart disease, obesity and other lung problems as well. Apart from that, we tell patients to do a regular exercise, at least 15 minutes a day, and that helps you improve your body health, improve your weight, improve your heart disease, as well as reduce the stress in your life. Not just reducing the health, improving the health also reduces the stress in your life. Fourthly, we tell patients to avoid stressful situations. Try not to get too worried about little things in your life, because this stress and anxiety can help cancers grow, and also can have heart problems and diabetes as well. So healthy eating, walking, avoiding smoking, and as well as staying away from stress.